My ultimate goal would be that things play nicely together in the sandbox, so that it isn't so hard to integrate and try to get a connection to your EHR, a connection to Workday or ServiceNow or any of those big systems which hold all our data and are really important to run our organization. But yet we want to be nimble and be able to do other stuff with those main systems, to be able to do that without having to wait 6 months to have IT be able to connect something to it.
From healthcare IT leaders, you're listening to Leader with Ben Hilmes. Our guest today is Crystal Broj, Enterprise Chief Digital Transformation Officer at the Medical University of South Carolina. In our conversation, Crystal discusses MUSC's commitment to better healthcare through innovative technologies, including AI tools for increased operational efficiency, and a voice bot named Emily for a better call center experience for patients.
Crystal, welcome to Leader podcast. It's great to have you and excited about, the topics we're going to talk about today. I really appreciate your time and look forward to the discussion. For listeners who don't know your health system, I've known you guys for years as MUSC, but tell us a little bit about Medical University of South Carolina.
Sure. So MUSC is South Carolina's only comprehensive academic health system with a strong emphasis on patient care, research, and education as a tripartite mission. We were founded in 1824, so we're celebrating our 200-year anniversary, one of the oldest medical schools in the East Coast. We're consistently ranked nation's top hospitals, and we're known as a leader in innovative research and healthcare delivery, mostly for our integrated approach, which comes from combining state-of-the-art clinical care with cutting-edge research to really transform health outcomes for the communities we serve in South Carolina. We're based in Charleston, but we serve the entire state, all 26 counties.
Charleston's an absolutely beautiful place to live and probably a great place to work as well. So I read your annual report. That is just chock full of value that you and your team are bringing to your organization. But at the macro level, you centered around 4 goals. So can you start there? And then I'm going to dig into some of the things you're doing because they're really exciting. And I think our listeners are going to enjoy hearing about some of the advancements you are making.
The digital transformation department actually sits out of the IT department outside. So the goal is to hopefully move faster on some of these transformational projects. But our goals are to make sure that we enhance customer care, and we call it consumer care because patients do have a choice. And it's all about our patient experience using technology to make accessing healthcare seamless, making it as easy as booking a dinner reservation or a flight. It still drives me crazy today that you can get on Amazon and order your Christmas presents faster than you can actually make a connection with your healthcare provider. We support care teams. That's our second goal. And we do that by leveraging automation and AI. We're trying to ease the administrative burden on our clinicians so they can focus on what they do best, which is caring for patients. We're trying to drive innovation and impact. We prioritize projects that can transform healthcare outcomes, from deploying things like AI-driven tools to enhancing our telehealth services, which we are one of 2 national telehealth centers in the country. So definitely proud of that and keep working through that. And then we streamline operations. Efficiency, especially in this day and age, is super critical. We know that the workforce, not just for providers, but also our team members in the office, whether it's front desk or back office, there aren't enough of them to serve patients. We can't get enough. So we want to simplify patient scheduling or use robotic process automation to optimize revenue processes, cycle processes. We're just trying to remove the friction wherever possible.
That's great. You talked about you launched a massive digital transformation journey in 2024. And I love the fact that you said it's going to be flexible because it's going to reflect the needs and the goals and objectives of the organization. On the early stages here, though, it's highly focused on the consumer. And you really talk into some of the big things around access and virtual care, personalized experiences. Tell us about, kind of what drove that and kind of what you're doing. What are some of the early successes? And maybe even more importantly, what are some of the early learnings?
The biggest learning is to start small. All of the projects that we've started, we've done with really small pilots or small areas, and then worked out the kinks, worked very closely with our user group so that they felt engaged and informed as we move forward, and worked on a little bit before we grew it wider and grew it wider and grew it wider. Our voice bot, for example, we started with 5 lines the first day. And then the next week we added some more and we added some more. There's 40 lines that go into our patient access center. We started that in June. We've been going for 4 months now. All 40 lines are live, and our voice bot, which we call Emily, M for MUSC, is a natural language processing voice bot that we put in to enhance patient access, help answer questions, schedule appointments, and direct patients to the right resources. She handles thousands of calls monthly. She's improving call center efficiency and letting our staff be freed up to take on more complex tasks. She can answer just the way you and I are talking now, Ben. Hi, this is Emily. How can I help you? I'd like to change my appointment. And within those 4 months, with her answering the calls 24 hours a day, she actually handles about 18 of her appointments after hours being scheduled or checked on, about 14% that are canceled. That has really given us some really great things. Our speed to answer decreased by 52%. We have a 43% improvement in abandonment rate, and it's only been 4 months. So I'm super proud of that project and the work that we've done there. We're getting ready for Emily to get to reschedule appointments, which will really help. That's a little more complex. So we've, again, success with our first one. And later this month, she'll start answering calls in Spanish as well. And then we'll start moving it to other departments. Revenue cycle, it has long wait times. We're hoping to put her there. Pharmacy, a couple other places that are very excited to have Emily join and be part of their staff and take some of that workload off of humans and let them work on higher priority items.
That's interesting. I want to dig a little deeper on really how do you capture and prioritize kind of where you go next with that, right? So there's, I imagine, as people are seeing the value of Emily, they're all lining up at the door saying, "Hey, I've got an idea. I've got an idea." How do you iterate through all of that? And how do you then make decisions on what gets prioritized, funded, et cetera?
The departments have to fund it themselves, so they have to have the money to do that, obviously. But then it's also, who's really ready for that kind of change? Who's willing to give us the staff members to engage with it? Because it's not just like we plug it in like you do a refrigerator and it works. It takes some time, and you really have to train the bot for the type of questions that it's going to answer. One of the big learnings for us was, AI is not flawless, right? We know that. So we started because you have to authenticate to find out who you are so that I can get Ben's appointments, right? So you can't get my appointments. You have to get just your appointments. So we ask, for example, we started out asking last name. What's your last name? My last name is Broj. So I'd say, oh, it's Broj. Oh, Broj, Broy. No, 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 Broj. And then she goes, oh, your last name is no, 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 Broj. No, B as in boy, R as in whatever. Remember, at the end of the day, it's a computer program, right? And so we were like, okay, well, we could feed in all 10,000 names for South Carolina. So we did that. We got a little bit better, but it still wasn't good enough. So it's like, well, we could do as in and do the NATO alphabet, as in alpha, as in Bravo. But like we live in the South. So some people might say, this is B as in bourbon. And I can't code for that. There's nothing I can do. We still maintain that security when we do that. But that's just the learning that if you say 1124, she doesn't understand because she expects it to be 0101. And so having to train the bot so they get used to that and what we're looking for is one of the big learns. But we still move forward. We don't sacrifice good to wait for perfection. And I think that was one of the big learnings that we had this summer with Emily is just being patient, training her, watching how she answers, and then adding to the model as we went forward.
That's awesome. I think that's really great insight into how you're using this in the iterative form and understanding it's not perfect out day one. We're going to continue to learn, advance, et cetera. I love that. It doesn't keep you from innovating. So another pilot that you guys have launched, and I expect this probably makes you really, really popular with your providers. You guys have figured out how to reduce provider after hours by 37.5%. You share a little bit more about what was the focus there? How did you do it? And kind of where is that going? Because I assume everybody's wanting to figure out how do I reduce my after hours by almost 40%.
We partnered with Nuance Dax to pilot ambient technology. So literally it works on your phone. And so you can go into the doctor's room and they actually capture the conversation. We train our providers to say, I'm going to use this as my virtual scribe. It will take everything that I take and then we'll put it in the EHR. So it makes me do my notes faster and probably more complete because I'm talking to you live right now. And so we started with a small pilot, just a couple providers so they could be our change champions. And then we grew it and grew it. So we're just finishing up the pilot. We did it for a year. And you'd be surprised, Ben, how much the technology has even changed and gotten better in that year. So even providers that started and they weren't loving it, as they've seen the technology grow and change, they're like, don't take this away from us. We loved it. And so as we learned a lot about change management, we learned about how, as we knew things and we wanted to, share information about the project as we were moving forward, how the doctors really like to get it because not all doctors read their email. And so we had to figure out how to get them information quickly and things like that. But that technology really allows clinicians to focus on their patient interactions, less on documentation. And that's been a game changer for provider satisfaction. They're actually not, they didn't go to medical school so they could type in the EHR, right? They did there because they wanted to take care of patients. They're much happier and healthier because they can do that and focus on that. And we were worried about patients. Like, how would you feel if they said they're using this AI technology? And it's been very positive that patients in the exam room, because they're like, my doctor looks at me. My doctor spends more time with me. Whether they do or don't, the perception is that they're getting higher quality care and more attention and a more personalized experience. So all the way around, it's been very, very promising. But again, with AI, it struggled at the beginning. It's like, oh, it's not putting this note in exactly the way I wanted, or not putting in somewhere. We had to train the model so that it could get better. But we're very, very happy with where it is and where it's going.
I've worked with providers in almost my entire career. And one thing they don't have in many ways, and I don't want to stereotype, is a lot of patience. Their time is incredibly important. But it feels like you're finding that they're leaning into this, willing to accept that it's a learning model and that they have to spend the time with it to get it to where it works for them. Are you seeing resistance? Are you pushing through that? Change management.
What we've learned through the pilot is that it's not for everyone, right? There are some doctors that are super good at Epic EHR, and they've created smart phrases and all kinds of great things, and they know exactly how they want to type and they can do it very quickly. They didn't love it because they didn't have to want to learn a new system or they were faster doing it another way. We still have some doctors that use, human scribes and they've worked with that person for years. So all they have to do is like look or scratch their head and all of a sudden they know how to do it. And so giving them a different tool probably isn't going to make them more efficient. And so it's not a one size fits all, like where, you get your computer, you get your AI scribe, you're done, boom. It's a toolkit and providers need to pick the tools that are right for them in their practice, what they're doing. But it was popular enough and we see enough results that we're going to offer it system wide across the state for providers that want it starting in the new year. So we're very excited with that program and the results that we've gotten. We're closing charts faster, which is makes patients happier, which makes our collections faster. They're not spending their pajama time doing the documentation, and it's a good project.
That's great. So those are two big efforts around the consumer, around the providers. Those sound like they're going to just explode and expand as you move into 25 and beyond. What else is on the horizon? What are the big things you're going to be tackling next year?
So we've had some really good success with robotic process automation, and we use Notable for that. They've been really good partners. And so we started again really small. We started with pre-visit check-in with our goals of tracking KPIs for how many visits are being checked in, our no-show rates, our copay collection with that pre-visit thing. So you get a text. It says, oh, Ben, you have an appointment in 3 days. Do you want to confirm or cancel? You confirm it, it uploads your insurance, it uploads your driver's license, it takes all your demographics so that when you walk in, you aren't given a clipboard by Susie at the front desk, right? It's a wonderful thing. We saw the pre-registration increase from 20% to 54%. So people are really engaging with it. We started there. We moved down so that for our frequent flyers, that have to go to the hospital or whatever 3 times a week, they would get a notification 3 different times. We took patient feedback into account because we read all of the feedback on all of our tools and they said that's too much. So we consolidated. So on Sunday nights for people that have more than one appointment, they get it for the whole week and they check in for all their appointments one time. That's it. We started launching that in Spanish as well. So that was also very well received. We expanded it. So now we're doing care gap closures with robotic process automation. So we started with, and we very slowly started reaching out to women who were a year or more behind on their mammograms, which happened a lot after COVID. And so people just didn't go and get their tests. And so we sent out in the spring a bunch the first week. And we actually heard from some of our hospitals like, wait, this is broken. What do you mean it's broken? Like, no, we're getting too many mammograms scheduled all at the same time. We've never had our mammogram schedules this full. this is a good
Is a
thing.
that's a good problem to have, right?
It was a
Exactly.
great thing to have because if you have an adverse screening, we want to make sure that we call someone within 24 hours and we weren't ready for an onslaught that quickly. So the first night we turned it on, we had like 190 women scheduled mammograms without calling, without doing anything. They just got a text and they did it on their phone. That campaign, we had over 2,000 mammograms scheduled, 164 with abnormal findings. So we called them. We got those women in for additional scans or treatment or whatever. So, this is a place where technology is literally saving lives, right? For the spring, now we've done well child visits, we've done flu shot reminders. We're letting people know if their Medicaid needs to be reviewed. But in the spring, we'll start doing diabetes, hypertension, and a few other care gap closures. Colonoscopies, I think, is on the list. So to make sure that you're taking care of yourself, because we worry about your whole well being. Then we're going to use robotic process automation. We just started our pilots for revenue cycle to actually submit prior authorizations if you need an x-ray or you need a CT scan or whatever. And so right now you get that order, somebody goes in, types it into a portal for that insurance company, and then takes the code and puts it back into Epic and types that in there. Now that happens, and that can take 10 minutes sometimes per order. Where this way we just go through and go, oh, Crystal needs a MRI. It goes automatically to the portal, checks and see if my insurance will cover it, puts it back, approved or denied. And then those people that were doing that can now just look at the denials and see what's needed to actually get that approved. We're seeing about 40% of those happening automatically with our first round. So excited about that work as well. And then we'll start working on referrals in the same vein, like start small for those referrals. Oh, Crystal, you have a referral. See Dr. Ben. That's been processed on the back end. You may now use this to schedule with Dr. Ben. So those are some of the robotic process automation, sort of low end AI, but it's super powerful.
I'm really happy to hear you're focusing in on some initiatives inside of revenue cycle. I personally believe there are many areas of healthcare that need to transform, but that area I think is where we can get the most leverage in many ways by leveraging technology, several of the things you just talked about. So it's really exciting to hear your focus there and can't wait to hear some of the what happens in 25 and beyond. Taking that back up a level though, because you're having to think out in future horizons. And so talk to us about, because you mentioned earlier, we seem to be behind other industries in healthcare. And we hear that a lot everywhere we go, especially from a digital transformation standpoint. What other industries do you study? What are you learning? What are you seeing? What do you think is more future, but not overly distant future that will be bringing new capabilities to healthcare?
Look at how people shop, right? Amazon changed the world, especially during COVID. You look at Uber and how, you used to call for a taxi and now you have an app on your phone and somebody's there in 3 minutes to pick you up and take you to the airport. You look at the airline industry and how easy it is to book a flight. I could be doing that right now while we're talking. It's that easy. It shows you all the times, it shows you all the things. And that's the type of experience that people are expecting in digital now. There's no divide between, oh, those young kids use that cell phone for that anymore. It's like, my 85-year-old mom can do it, right? So it's totally able-bodied and it breaks down barriers, and people are expecting that. I think that we'll see more and more people are expecting more personalization. I should be getting things that are sent to me based on the fact that I have asthma and it's spring in Charleston. Health nudges and, think about this or think about that as you're going forward. So I think we'll be seeing AI really taking off in that area. We'll see AI to start looking at diagnostics and start looking at your chart and where there's so much stuff in a patient's chart. It could be 20, 30, 50 pages of faxes and this and that. And doctors just don't have the time, but AI can go through and pull up the next three things that you should talk to Crystal about when they come in and remind me as well. Like, you want to talk to your doctor about your asthma, you want to talk to your doctor about this, you want to talk to your doctor about that in the pre-registration so that, or say what's concerning you and then put that on your tickler list and on the doctor so that you don't forget because you get nervous when you go to the doctor. So being able to predict patient needs, maybe intervene sooner. I think there's going to be a lot more on wearable tech. I mean, everybody's got their smartwatch now, right? And it can tell me all kinds of things. But taking every single reading from a smartwatch or a CGM or whatever and just data dumping them to the EHR and then expecting a doctor to try to read through it to go, did Crystal walk 10,000 steps every day for the past month? I could show them and they'll be like, that's a good girl. As opposed to, you used to, and now you haven't. Well, I can't because I hurt my knee or whatever. And being able to address the issues, I think taking that health data and making it actionable in real time is going to be something that's coming up on the horizon more and more, and allowing our patients to get care where they are. If I have more devices, more things in my house, then I don't have to go just so that you can see my thermometer reading or whatever, right? I could do that from home without having to go out. Coming from Chicago in January, I would not want to go to a doctor, right? Because it's 30 degrees below zero. Not so much in Charleston. I probably still go out. But even so, you have a sick baby, you don't want to take it out, those kinds of things, making it easier for patients to have that care. And then I think generative AI is really we talked about rev cycle, but all kinds of administrative tasks, from stuff that the clinicians need to do to stuff that team members need to do. Every department can use it. I mean, we know that, marketing departments are using AI very extensively, and it's really helping them generate content, doing things like that. So I think we're going to see widespread, we're a university too. We're training up our professors on AI so that they can use it for lesson plans and making their courses richer and things like that. So we're going to see it all over the place, and that's going to really explode. And I think when I started my roadmap 2 years ago, we didn't even have generative AI. We hadn't talked about doing natural language processing voice bot, and that got added in as stuff became available. So you have to make a really good roadmap with a lot of plans, but you have to really think about being able to pivot and see what's important and what's going to bring you the most value. And when we talked about how do you schedule, all of a sudden, like knock, 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 digital transformation solved my problem. You've got to be able to see, do you have the time? Do you have the patience? And then, is it really a problem that needs to be solved? And what kind of impact can you have? And I think keeping track of what's happening today and the KPIs that you have and knowing what you want to show the change for is the best way to go about doing that. And that's kind of how we set up all our projects. It's like, okay, what are we trying to move? What needle are we trying to move? Can we measure it today? How will we measure it and know that this distinct system has made the change? Because now I've got a lot of systems, right? I've got Emily, she answers the phone. I've got Notable that's scheduling patients. We're going to have a new digital front door for our Find a Doc with Dex here soon. And all of those things are doing patient engagement, but being able to track which one's moving the needle in which places is super important to value and make sure that, a year from now, 2 years from now, this tool's still doing it, or do we need to find something else?
There's no better time than today that to be in digital transformation. Your toolbox is you wake up every day and there's something new, you're learning something new. Like you said, even 2 years ago, we didn't even have some of the basics around AI that we have today. Well, what's 2 more years going to bring? Who knows? That's the exciting part, I think, to be sitting in the seat that you sit in. But if you did have kind of that crystal ball and you could kind of look out 3 to 5 years, how would you describe what you're seeing? It'd be very interesting to hear from your perspective, given where you've been, what you're doing, and kind of where you're going. Just share some of those thoughts with us.
I think that we will see more automation and that we'll start thinking of bots as our team members. And we will, co-pilots, team members that help us do the work that we're doing and let us work on more difficult tasks. So writing a denial letter should be able to be done as we talk about rev cycle. There should be an automatic and then be reviewed rather than something you have to sit and type it in, for example, or, any of those tasks that are repetitive or whatever. But also, I think we'll come upon a time when the bots will be built in such a way that departments can build their own bots. And it won't have to just be digital transformation, or we won't be buying XYZ software for revenue cycle and ABC software for this department and PRQ for pharmacy or something, right? We'll be able to go, here's our bot platform. We know how to get the patient record, so we can pull that back. We know how we can do this. We do this. We can string those things together, and we could give that toolbox to people that are super builders in departments, and they can build their own that will help them do that with guardrails, of course, and things like that. But I think that that's going to be something that will come eventually that would be super exciting and actually allow us to move faster, because there's just me and my team, and we have to prioritize things and do things in a certain way. I also think we'll see the tech becoming more reasonable as well. And so I'm hoping it is. And my ultimate goal would be that things play nicely together in the sandbox, so that it isn't so hard to integrate and try to get a connection to your EHR, a connection to Workday or ServiceNow or any of those big systems which hold all our data and are really important to run our organization, but yet we want to be nimble and be able to do other stuff with those main systems to be able to do that without having to wait 6 months to have IT be able to connect something to it.
Right. I hope you're absolutely right on the technology becoming more reasonable because there's a big gap of the has and have nots in the healthcare delivery space. And, I'm hoping that more and more innovation advancement can be made more available to really anybody that has the leverage and the ability to go drive some of those transformations. But this has been fascinating to me. You've got an awesome job. You live in a great place in this country. You work for a great organization. They're very, very lucky to have you. And it's exciting to see all the things you have going on there. Really excited to see the continuation of this journey for you and MUSC and kind of see where you take it. And I would encourage all of our listeners to go out and get your annual report. Not everybody does that. And I thought this one was very well done. I think it's a great thing that people can use and think about how do they create their own. I know one of the challenges you probably have every day is you're probably viewed as a large cost center. And you're also looking at, let me tell you about the value we are creating inside the organization for the spend. So just an excellent job, Crystal. I love what you're doing and excited to see where you guys continue to go. And thanks so much for joining me on the podcast today.
Thanks, Ben. Talk to you soon.
I sure enjoyed my talk with Crystal. There are several great takeaways from our conversation, but here are a few that stuck out to me. 1, MUSC is embracing voice bots and other automation to make healthcare access as seamless as online shopping. 2, Crystal's advice for change management is to start small. Pilot programs allow her team to gather feedback and make adjustments before a wider rollout of new technologies. 3, AI has reduced charting time at MUSC by nearly 40%. That improves the well-being of clinicians and the quality of their interactions with patients. So what did you think? What are your big takeaways from the episode? I'd love to hear from you on our social media channels or drop me an email from our website at healthcareitleaders.com.
Thanks for joining us for Leader to Leader. To learn more about how to fuel your own personal leadership journey through the healthcare industry, visit healthcareitleaders.com. Don't forget to subscribe so you don't miss any insights, and we'll see you on the next episode.